Let's start with the introduction. COVID-19 pandemic, first identified in Wuhan, China, has caused widespread panic and uncertainty worldwide. The virus, believed to originate in bats, spreads through respiratory droplets and is highly contagious. The pandemic has put immense strain on healthcare systems, leading to shortages of essential supplies and overwhelming hospitals. The virus can be spread by individuals who are not showing symptoms, making it difficult to identify and isolate infected individuals. Governments has implemented measures such as lockdowns, quarantines, social distancing guidelines, and business closures to slow the spread. However, these measures have also had a significant impact on the global economy, leading to job losses and financial hardship. The pandemic has also impacted society, forcing people to work from home, close schools and universities, and disrupt social activities. Mental health issues such as anxiety, depression, and loneliness have also been affected. As the pandemic continues, it is crucial for individuals to follow public health guidelines and precautions to protect themselves and others from the virus. As of April 17, 2020, Malaysia's Ministry of Health (MOH) recorded 5,251 COVID-19 cases, 86 deaths and 2,967 recovery cases. Selangor has the most confirmed cases, with 27 districts classified as red zones. The MOH immediately developed standard guidelines for COVID-19 management, with 34 hospitals and screening centres designed in each state. The first Malaysian case was confirmed on February 4, 2020, and the first patient to recover from COVID-19 was a 4-year-old Chinese national girl. The number of reported cases increased slowly until a religious event in Sri Petaling, Kuala Lumpur, triggered an exponential increase. The expansion of COVID-19 to other states and surrounding nations was fast. The government issued a Movement Control Order (MCO) to combat the spread, and as of April 10, 2020, 4,346 cases were recorded, including 70 deaths and 1,830 recovered cases. The WHO predicts an exponential increase in cases, leading to further measures. Let's moving to the next part, which is purpose. The purpose of this assignment is to study the action taken by the government of Malaysia to enforce a movement control order to break the chain of COVID-19. The primary goal was to reduce economic and social consequences, limit its expansions, and offer care to its residents. Citizens made several contributions to the fight against the pandemic. The first action taken made by the media is by using social media platform. Twitter have been used to communicate and connect with the public during cases. The hashtag Stay at Home has recently gained popularity in the media, and people use this hashtag to give awareness. Next, the Movement Control Order, which is MCO, has had an impact on the Malaysian economy. Most organizations allow their employees to work from home, and some have had to stop working. NGOs have actively assisted persons impacted by the pandemic. They have provided food and shelter for the homeless, as well as financial assistance to individuals in need. Also, some NGOs have helped by supplying protective masks, disinfection chambers, and educating citizens about COVID-19. COVID-19 has forced educational institutions, including schools and universities, to close. However, this has not stopped researchers from many universities from assisting citizens in fighting COVID-19. Universiti Putra Malaysia, UPM, for example, has developed fast hand sanitizers and face shields. COVID-19 has created a global threat, prompting a new normal lifestyle in Malaysia. People are working from home, wearing masks, washing their hands frequently, and staying away from crowds. The virus spreads easily through respiratory droplets, contact with infected individuals, and contaminates surface. The COVID-19 pandemic has significantly impacted Malaysia's economy and financial markets, which the financial markets predict to collapse and a new global recession. The government's sudden enforcement of the MCO has put various sectors at risk, including tourism, manufacturing, construction, mining, and agriculture. The tourism industry has suffered significant losses, with an estimated loss of RM3.37 billion in the first 2 months of the year. Malaysia has taken several actions to recover the economy, including a RM20 billion financial stimulus package announced by former Prime Minister Tun Dr. Mahathir Mohamad in February 2020. The strategies include lessening the impact of COVID-19, promoting people-based economic growth, and encouraging quality investment. The government has also implemented several economic measures to address the pandemic, such as extending import duty and sales tax exemptions for port operations, machinery, and equipment.
For method of investigation, we use secondary data to get information on COVID-19 cases in Malaysia. The information obtained from main sources that we can easily use in our study. Secondary data sources include website, publication, statistic, and content analysis. This strategy provides basics, accessible, and understandable data, making it easier for us to comprehend the issue. Also, it can help students because it saves money, time, and effort by removing the requirement to gather data from the beginning. Next is limitation. Our essay on COVID-19 faced challenges due to limited time and a group of fewer members. Balancing multiple tasks and responsible lead to increased workload and time pressure, potentially compromising the quality and depth of our research. This could result in burnout and lower productivity.
Moving on to 2.1 COVID-19 cases over the years. In 2020, we started slow with 2% as the virus started to spread in our country, Malaysia. Then the virus infected Malaysia drastically from 2% to 51% in 2021. This leads to overloading the healthcare system and forced a lockdown in the whole country. The government also made a public health precaution such as wearing a mask and keep a 1 meter distance between each other. Launched in February 2021, the vaccination program finally showed a result in late 2021 with a notable decrease in infection cases. The government made it clear to the whole country that we are supposed to get a vaccine, which is to decrease the infection of COVID-19 in Malaysia. In 2022, it decreased to 43%, which is 7% less than 2021. But then another spike in cases because of the Omicron variation. In the middle of 2022, to continue the immunization, we are allowed to take booster shots, and that caused to reopen the international border. We are allowed to go vacation, to go out and go to work normally, as it is getting better over the time. Then in 2023, the infection decreased drastically to 4%. There is a small increase in 2023, but it is very controllable as we are already immune to the virus and we already had 2 shots and booster shots. Overall, Malaysia experienced a flexible measure, widespread immunization program, and slow transition towards endemicity. Moving on to COVID-19 yearly vaccination in Malaysia. In 2021, when we started the immunization program, more than 57 million took the vaccine to attain herd immunity. In February 2021, set a goal of immunizing at least 80% of adult population. There are 3 types of vaccine, which is AstraZeneca, Pfizer and Sinovac. In 2022, more than 14 million people took the vaccine and it is extended to 5 to 11 years old. The booster program started in October 2021, which aims to strengthen the protection against new strains. Lastly, in 2023, more than 289,000 people took their vaccine.
COVID-19 death yearly in Malaysia. COVID-19 pandemic significantly impacted Malaysia, beginning with the first reported cases on 25 January 2020. Based on the statistic above, on year 2020, the death reported is 560, primarily affecting elderly and those with underlying health condition. Moving on to year 2021, it is to be proved that the new variant and the new Delta variant really affecting Malaysia critically. By statistic, the total death number is 31,064, making the pandemic the most devastating period in Malaysia. With the rollout of vaccine in the beginning of early 2021 and accelerating through 2022, the situation began to improve, and with the boosted by the government, the total deaths recorded on 2022 is 5,313. Continuing with the campaign and public health measure by the health institution, on 2023, the statistic shows that the death recorded is decreasing year by year. Malaysia remains vigilant in managing COVID-19, reflecting a global struggle marked by high impact period and subsequent decline due to effective health intervention. Moving on to 2.4, tests conducted over the year in Malaysia. On 2020, the initial phase of the pandemic, COVID-19 testing in Malaysia was relatively limited. The first case were identified in January 2020. The testing was conducted primarily for individuals with symptoms and contact with confirmed case. As community transmission become apparent, the government expanding the testing capabilities to RTK and PCR.
In the last part of my presentation, we are going to talk about patients in ICU during COVID-19. In 2020, 15,605 people are admitted to ICU. Mostly the patients who are extremely sick and already have health problems are admitted to the ICU. Then drastically increased in 2021, which is more than 268,000 people admitted to the ICU, which placing a burden on country's healthcare system. And there has been a report of the shortage of ICU beds, ventilators and other crucial medical supplies, which is make it more difficult to the ICU patient. And in 2022, as majority of the population took vaccine, it decreases to 41,070. And lastly, in 2023, it drastically decreases again to 4,845 people admitted to ICUs. And that is all from me. Thank you very much.
So now we talk about impact of government initiative in Malaysia due to COVID-19. First, the Prihatin Rakyat Economic Stimulus Package, which is Prihatin, was launched in March 2020 to provide financial assistance to low-income household and business affected by the pandemic. Next is Penjana Package, launched in June 2020, aimed to stimulate the economy with tax break, investment incentive and business grant. And then National Economic Recovery Plan, which is Penjana, was also implemented to boost economic growth and create jobs. Lastly, government must continue to monitor the economic situation and take additional measures to support long-term economic growth. So in conclusion, COVID-19 outbreak in Malaysia has significant impact society and the economy. Secondly, Malaysia government has implemented a comprehensive vaccination program to prevent the virus from spreading. And then, the healthcare system has been particularly affected by the influx of critically ill patients, straining ICU capacities. Government has launched initiatives to mitigate the economic impact, include financial aid, package and support for affected industry. Lastly, government need to remain proactive in addressing the ongoing challenges posed by COVID-19 to ensure the health and well-being of the people and the stability of the economy.
Recommendation to decrease COVID-19 cases. First, expand vaccination campaign to reach all corners of the country, particularly in rural and undeserved area. In search for new variant and reach more people with symptoms. Number 2, wear mask and practice sanitation every day. Number 3, check body temperature regularly. And number 4, do COVID test if symptoms occur.